Hey, this is Dr. Tasha, and I'm talking to you guys today about the Fresh Start Retreat Getaway 2025. It is a 2-day, overnight, all inclusive, all food, all drink, all entertainment retreat. It is a refresh, a revive. We are going to empower you. We are going to educate you. We're going to make you laugh. We're sending you home with some gifts, prizes, and money. We're sending you home with new relationships. Do not miss this. If you think you came to a good one last year, we had nothing on this year. Don't miss it. I'm excited to participate in this one, y'all. October 17th through 19th here in Atlanta, AC Marriott Hotel. Fresh Start Retreat 2025 is up. Hey, this is Dr. Tasha, and I'm coming at you for Dr. Tasha After Dark with one of our sponsors who we love, Wet Kitty Vaginal Lubricant. It is that girl. It is odorless. It is colorless. It is tasteless. I said tasteless, girls. It will not cause any vaginitis, will not cause any irritation. It does not dry. It does not get sticky. How you put it on is how it will remain on until you wash it off. We love her. Wet Kitty. Officiallypleasured.com is where you can find it. Hey, y'all, this is Dr. Tasha, and I am back with another episode of Dr. Tasha After Dark. Now, we're going to talk about some stuff today. We're going to talk about some grown people stuff, some grown lady stuff up here today. Now, y'all know what I always say. Don't come for me down in the comments because a hit dog will holler. I'm just saying, okay? Today, we're going to talk about loose coochie. Now, First and foremost, okay, I am very much, knowing what I know as a gynecologist, when we talk about the anatomy and loose coochie, it's really not a thing, right? And I'm going to get to what that means. Don't be gaslit. And a lot of times women are going for surgery, women are going for procedures, women come in and they're going for vaginal rejuvenation. All types of stuff that people are overcharging the hell out of you for because they can. Because somebody has convinced you that you got loose coochie. Now, did they say bad coochie? Did they say dry coochie? Did they say smelly coochie? That's different than loose coochie, okay? Now, I'm always a proponent when somebody says, well, he said it's kind of loose. Well, how big is he? How big is he? Because at the end of the day, everything is subjective because is your coochie loose or is his penis small? So don't be down on yourself, sis, first and foremost. Now, what I want to say is when we talk about the loose cooch, we're talking about the vagina. We're talking about inside of the vagina. And then like, I mean, I, okay, so let's get to this. Let's get to this first and foremost. The vagina is elastic. Have you ever seen a rubber band that stretches in one direction and doesn't stretch back in that same direction? Because that would make it not elastic, right? Because what we doing here? No, the vagina is elastic. So it is going to stretch to accommodate anything it needs to accommodate. It's going to stretch to accommodate whatever's going in, and it's going to stretch to accommodate whatever's coming out. And over a time period, it's going to go back to its original form. Now, it is not to say that the vagina does not change over time. Age and childbirth changes it a little bit in a way, but it's not to say that it stretches it out and it doesn't go back. That's not a thing. The vagina is elastic. So technically, there is not even a such thing as loose coochie. I'm just saying it doesn't exist. Okay. Now, let's talk about what actually happens with the vagina during sex. Okay. Because when somebody says, oh, you got loose coochie, that's generally used to shame you. Those are people who are trying to shame you. If you're hearing that, then that may be a clue that you're in something with a gaslighter. That may be a clue that somebody is trying to shame you based on your history or based on what they know of your history. Medically, some things happen to the vagina, but not loose vagina. Okay. So just be very cautious of that. And I'm not saying be defensive, but don't be like, oh, my coochie is loose. No, stand up for yourself and be like, well, is my coochie loose or is your penis small? And it is what it is. Every saint, what is it? Every saint, some what is it? Saints was the sinners and sinners was saints. However they say it. All saints got to pass or whatever they say. Okay. So don't be let nobody make you feel like you loose as a goose, because you was off the porch in your younger years, or you might still be off the porch, but that's not the point. Okay. Your cooch is your cooch. Here's how vaginal muscles work. Vaginal muscles relax when you are aroused. So the math is the math. Your vagina relaxes when you are aroused. Point blank, period. Okay. Now, when it comes to, tight vagina and what's tight and what's not, tight cooch and all that, like I said, the vaginal muscles relax when you are aroused. So if you're not aroused, if you're not interested, or if you're just physically not prepared for penetration, meaning you're just not wet, then yeah, it's going to seem tight. So when he's like, ooh, it's tight, that's probably a girl who don't like you. That's probably a girl who really is not that interested in having sex with you. So, what's better? A super tight vagina that is just not ready to receive you, doesn't want to receive you. The vagina won't stretch. It won't relax, and it won't lubricate if it's not aroused. So ask yourself that question. How loose is her cooch now? Okay, I'm just saying. Now, the problem with that is oftentimes that can lead to very painful intercourse and sometimes impossible intercourse for the male as well. Okay. So that doesn't always make for a good situation. Now you say, well, no, I even feel like my vagina is not as tight as it used to be. Maybe. As we age, things start to change a little bit. And, you know, even as far as tightness is concerned, people are like, well, I'm getting older. Remember, I always tell y'all, if you don't use it, you'll lose it. This is a little bit of that, meaning like as you age. So anybody who's starting to go through menopause, perimenopause, it can start in your 40s. And childbirth as well can create some changes as well. And so the vagina gets thinner and drier and less acidic. And because it's less acidic, it's more prone to infection, actually. Less stretchy and less flexible. So as we age, as this vagina goes through them saying, life be lifing, y'all. Y'all think life just be lifing for y'all. Life be lifing for that coochie too. Life be lifing. Y'all be putting that coochie through some stuff sometime, child. And life just be lifing. Okay. And you think that the vagina ain't going to respond, and it's going to respond, honey. It is going to respond. But, take care of it as best you can. That's all we can ask. And you want to be sleeping with people who's also going to take care of it. But what we ain't going to do is a whole bunch of name calling, talking about what's loose and what's not. First of all, sir, the problem is you, or ma'am. Okay. The problem is you. You ain't got me aroused. You ain't got me interested, and it's dry and it's tight and all the things. That's not a compliment. Because it should be enjoyable, and tight doesn't always mean enjoyable. Just saying. Okay. Now, if there's extreme tightness, there could be a medical condition called vaginismus. When you have vaginismus, don't nobody want vaginismus, baby. That's pain during intercourse. That's pain after intercourse. That's pain with tampons. That's pain with fingers. That's pain with the vaginal exam. Don't nobody want that. A lot of times it has to be taken care of psychologically. Sometimes you actually have to remove glands and nerves down in what we call the perineum, or the very, very lower part of the vaginal opening. So it can be a surgical repair. You can have to take medicine. It can be therapy, because again, you're so used to it being uncomfortable. You scared now. Anytime somebody come near that thing with a thing, you scared. You like, oh no, baby, no. And I've had patients who've had vaginismus, and it can be very frustrating. I'm a very patient person, but sometimes I'm like, girl. But the thing is that I have pediatric instruments, so I will take it to something that's as big as a pinky, and I'm gonna get in there and I'm gonna get the information I need. I'm in, I'm out, I'm quick. But the reality is sometimes patients don't understand that they have this condition, and surely partners are not going to understand, and then that leads to trauma, lacerations, tears, can lead to infection, and then just at this point sex is just all the way traumatic for them. It's just all the way traumatic, and they like, oh no, where you coming with that thing? What you think you about to do with that thing? And then don't be well endowed, and then you have somebody with vaginismus. It just ain't gonna work. Just pack your stuff up and say, let's just be friends, because this ain't gonna work. And you got to be okay with that. Everybody ain't for everybody. Okay. All right. Amen. All right. Let's move on. Now, let's say you in a situation, you like, Doc, I hear you, I hear all that, but I want my stuff tight. I want it tight as I can get it. I want it tight as I can get it. First of all, y'all know how I am about hygiene. Y'all know how I feel about hygiene. We ain't even gonna get on the hygiene thing, but as you want it all tight as you can get it, won't you want it clean as you can get it? Because I'm all for that. Okay, but if we say, okay, how are we gonna tighten this thing? Let's go from most extreme to least extreme, because things change, right? So I don't bring anything to y'all without knowing the real. I don't. So things change, so I update myself. Now, when I seen one of these things, I said, well, what in the Jesus Christ is going on in these streets? Now this sound a little scary, and it sounds scary. It's no and nothing. It just sound damn scary. Neuromuscular electrical stimulator. Now, if I break that down medically, okay. But basically, it's a probe. You put a probe in, and it sends an electrical current through the pelvic floor, and it spasms. It spasms, and I guess again that's a form of tightening. Just like, I guess it's kind of like doing the exercise for you. Yeah. You can do. Apparently, they sell them at the house. Now, I'm not condoning this. Don't pop up at nobody's ear. Don't go down to Grady telling them people you done electrocuted your coochie because you was trying to get it tight. Because baby, they gonna go in their break room. They gonna talk about you. Okay. Now you go down there with a real medical problem. They got your back. But don't go down there with this tomfoolery. Now, I don't know. They say they sell them for home units. I don't advise you do this at the house. I don't know what it involves. I don't know if you got to be grounded. I don't know if you can't be near the water. I don't know. Okay. And half y'all partners ain't got, too much wherewithal to know whether they doing the right thing. Or your doctor can do it. I would say just go to the doctor. Just even if you got to take the unit from the house and say, Doc, do you know anything about this? Can you help me with this? Can I pay you to do this for me? But I'm not going to recommend doing this at the house. Y'all ain't going to have me on tape saying, well, yeah, they selling for the house. No. I don't know nothing about it. I can't. Now, one thing, they also have a machine called a Mona Lisa. Now, the Mona Lisa machine, my friend had this machine. It is a pretty cool thing, because if you are tight, it opens you and loosens you. And if you are loose, it tightens you. I guess the settings, I don't know. But it's real interesting. It's like a metal penis is what it looks like. And you put it in and you twist and you twist and you twist and you twist and you twist, like you twirl it until you twist all the way out of the vagina. You do 2 or 3 different sessions, and you're supposed to be completely fixed up. It's about $2,500, $3,000. I don't know. I was not going to invest in the machine, and then I couldn't see myself convincing somebody to pay $3,000 for the coochie tightening and loosening. And maybe y'all would have, but I wasn't about to put my money on it. So, and then they have something called but it's called the Mona Lisa. Like the artwork is called the Mona Lisa procedure. So if you interested in that, it was totally painless. And after you have one treatment, you can't have sex for a week. And then I think like a month later, you go for another treatment. A month later, you go for another treatment. So after 3 months, you done paid your $2,500, and you're supposed to be all tightened up, and then you get a little touch up once a year. I don't know. From what I heard, it works. My friend said it works. She ain't get one. She's been doing them for people. She owns the machine. But it's called the Mona Lisa Touch, or Mona Lisa, whatever. Vaginal tightening. Look it up. Okay. And so then the next thing is vaginal cone. And so this thing's supposed to have a little weight to it. Now, I would say if you do this, stay at the house. We don't want to be at the Whole Foods nowhere and you got stuff dropping out your coochie. Please don't, just stay at the house with this. But apparently it's supposed to be something that, here we go with this tampon thing. Apparently it's supposed to be something that looks like a tampon, but it has weight to it. And you're supposed to put it in and tighten the vagina and hold it in place for 5 minutes at a time. And you're supposed to do that twice a day. I don't know for how long, but you're supposed to do it twice a day. And that's supposed to tighten up your cooch as well. Okay. And then we got the good old Kegels, which are free. Now, I don't know how much this vaginal cone costs. I don't know. They might have them on Amazon. I ain't even look. But the Kegels exercises are free. Now, I don't know. It sounds like you got to do 3,000-4,000 of them a day in order to see any results. But I'm just saying. And then they have this new thing, y'all. So apparently there is this new, what do you call it? I don't even know, this new specialty. And I don't want to call it new, but this specialty of medicine that's supposed to be on the rise, pelvic floor exercises, pelvic tilt exercises. They charge the people a lot of money for this stuff. I don't really even know. And I'm not exactly sure what they over there doing. It's supposed to be pelvic physical therapy. Now, all of my patients, and I didn't refer anybody for this because I don't know. It just don't sound right. I don't know. But my patients who actually found it on the net or TikTok or wherever y'all be finding this stuff, they paid for it and had 3, 4, 5 different sessions and said that they saw no difference. So I don't know. But like I said, these Kegel exercises, that's what they've been telling y'all for years to do, the Kegel exercises, honey. But it sounds like to me you got to do 3,000, 4,000 of them a day. So I don't know. You just are tightening and pulling and tightening and pulling. I don't know, child. Yeah, at some point you're gonna run into a little spasm. But either way, I'm just saying. But no, if you feel like, and if your doctor's like, yeah, wow, your vagina's gaping and and a lot of that too can be from a traumatic childbirth. If you had a 4th degree laceration, which is a laceration that goes straight down into your rectum. If you've had a severe laceration with childbirth, you had a huge baby and you tore. Everybody don't do good repairs, and you had somebody who did not necessarily do a good repair and your vagina needs to be built up again. That can be a thing too. That is a surgical repair. Again, because it's a vagina and it still functions, your insurance company 9 times out of 10 ain't fitting to pay for that. You're going to have to pay for it, but there is a surgery that will repair. So when I'm talking about loose coochie, that is a subjective thing that maybe you might feel or your partner might feel. But if we're talking about somebody who has legitimately had something surgical happen, a traumatic child delivery, a complication from a delivery, because sometimes you can have a repair. The repair will break down. The repair will get infected. Nobody is going to subsequently fix infected tissue. And then by the time the infection has cleared and passed, what ends up happening is now it's like, okay, well, you're fine. The person is so happy just to have their vagina back. They don't want anybody to do anything else. And then years go by, and then now it's like, oh, my vagina is gaping. I'm unhappy. It's not giving what I feel like it needs to give. That's a different situation than somebody subjectively trying to shame you and saying you got loose coochie. Because again, like I said, loose coochie does not exist. The vagina is elastic. It stretches. It does what it needs to do. But we have extremes. We tend to get a little bit older. It tends to get not as elastic as it used to be. So at the end of the day, if you are satisfied with the sex that you're having, if your partner is satisfied, no matter what it looks like in the mirror, no matter if you think it's gaping, no matter if you had a 4th degree, go with it. If you've only had a complaint from one person, maybe that's that person's issue. Maybe that person has some type of whatever, well, they need to feel whatever on or around their penis. And maybe they just have a small penis. At the end of the day, please, ladies, don't go out trying to do extreme things or doing extreme things to your vagina because of what somebody's subjective opinion is, because medically, we do not believe in loose coochie, tight coochie, and for all reasons that are pathological. They are not normal reasons. It should not be subjectively tight. So for all the reasons that we should have a loose vagina, not too loose, or we should have a tight vagina as people, not too tight. But all things are subjective. So nothing is black or white and nothing is by rule of thumb. So please, if you have a question or a concern about something that's happening with your vagina, the way that it looks, the way that it moves, the way that it's not looking or moving, or anything may or may not need to be repaired, please discuss it with your gynecologist, not a primary care physician. No offense, but this is a more specialized conversation that you need to have. So you need to have this with a gynecologist or maybe even a vaginal rejuvenation. Well, I can't really say that because I say it all the time. You go to a surgeon, they're going to find a reason to operate. You go to somebody who does vaginal rejuvenation, they're going to find something to rejuvenate down on your vagina. So your gynecologist who does not really have a dog in the fight, I would say ask them, is this normal? Should I be feeling this? I'm feeling this. Is this abnormal? Does this need to be repaired? Does this need to be addressed? And you hopefully will get straight answers. Okay. So guys, I hope this helps somebody. I hope if you're in a situation where you're being gaslit or you're being shamed, you can stand up and say, you know what? Dr. Tasha said that's not even a thing. So I'm going to need you to take 2 steps to the left, 1 step back, and close my front door because I'm over you. I'm over you. Okay. All right. Well, thank you guys for joining Dr. Tasha After Dark for another episode, and enjoyed having you. Bye.